empty if you don't come here, but if you want to come and join us, you can come and join us, inshallah. So let us begin, inshallah. If what we can do is all of the brothers that are done here, you please move over to this side, and we'll leave this whole area for the sisters, inshallah. So I just want to start off by thanking our esteemed panelists in advance for taking their time out, for them to come and give back to the community by helping educate the community. This is, as we know, that education is the key to so many evils and problems in society. And these health problems that we're dealing with, education is perhaps more effective than the most powerful medicine that exists out there. So I want to hand it over to the esteemed panelists, Dr. Imran Rauf and Dr. Sarah Ahmed. Jazakumullah khair.
Assalamu alaikum. Thank you very much for inviting us. Thank you to the leadership committee of ICBC Mosque. We really appreciate it. I am still waiting for the third person in our panel, Brother Shaju. I am an internal medicine trained physician. I work for a health insurance company. I see patients at the IXCIS clinic and also at Round Rock Sacred Heart Community Clinic. And happy to be here. I'm very passionate about cardiovascular disease and stroke. So I'm going to pass it on to Dr. Sarah Ahmed.
Assalamu alaikum, brothers and sisters. I'm really glad to be here today. I'm Dr. Sarah Ahmed. I am also internal medicine trained doctor. I am a hospitalist, which means I work in the hospital, admit and take care of hospitalized patients.
Thank you very much, Sarah. So Shaju, Brother Shaju, you go next.
Assalamu alaikum, everyone. So my name is Mohammad Siraj. My nickname is Saju. So I think most of you know me by Shaju or Siraj. And I'm working in IT field, working in a French company, name is Thales, as an operations manager.
Thank you very much. So let me just start off by maybe a definition of stroke. I mean, you guys have heard about the term stroke. Sometimes I get this question from my friends and family, is it the issue at the heart, is it brain, or is it somewhere else? So we really need to understand what the stroke is about. So I'm going to ask Dr. Ahmed maybe to explain it in layman's term for our audience. What is stroke?
Thank you, Dr. Rauf. So yes, Dr. Rauf, we always get this question that, is it heart stroke? Somebody had a stroke and somebody will come by and say he had a heart stroke or brain stroke. So the term stroke we use specifically for brain. So whenever, for any reason, the blood flow in the brain interrupts or is stopped in a portion of a brain, that portion of the brain starts dying out. And that's when people start getting symptoms, and that's what we call stroke. The thing is, the brain tissue is very, very sensitive tissue. It needs oxygen, it needs nutrition from the blood. So it's like only 2% weight of our body, but it consumes 20% of the blood flow goes to the brain to just give the nutrition. So whenever there is a cutoff of blood flow, that causes devastating symptoms.
Thank you very much. So we learned that stroke is having to do with abnormal function of the brain. So brain is not working right, brain having issues because the blood supply is cut off. So now we need to think about what are the risk factors for stroke? Who gets stroke? So something you probably know. So I'm just gonna go over very briefly. So there are common risk factors. I call them big four. So the big four risk factors, number one is high blood pressure or hypertension. Number two is diabetes. Number three is if you're a smoker, smoking. And of course, the big one also we know, which is high cholesterol. So high blood pressure, diabetes, smoking, and high cholesterol. If you have anyone, you or your family members have these four conditions, just think about the risk of stroke. With age, these things in the risk goes up. So these are the big four, and we'll talk about prevention, subsequently. But just think about these four risk factors in terms of risk factors for stroke. There are some uncommon risk factors for stroke. If someone has heart disease, many patients with heart disease also have same risk factors as stroke, like high cholesterol, smoking, clogged up arteries. Also, if there is a rhythm problem with the heart, if the heart is too large or heart is fluttering or not beating right, sometimes clot can form and the clot can goes upward to the brain circulation and cause stroke. I'm just going to also touch on the sort of the statistics. Why are we talking about stroke? So the statistics are very sobering. So just think about it. Every 40 seconds, someone is having a stroke. Every 40 seconds. This is the data from 2020 in the US. Every 3 to 5 minutes, someone is dying of stroke. Stroke kills people. People get unconscious. It's ultimately the brain function. If the brain is not working right, if you have a massive stroke, that can wipe out heart function, eventually death. And then each year, about 800,000 people get affected with stroke. And if you have a stroke, your chances of getting stroke is much higher. So stroke is a serious deal. So we'll learn more about that in terms of how stroke affects people. So I'm going to turn the mic over to Brother Shaju because as we know, he's a stroke survivor. So he's going to share his experience about the symptoms that he experienced when he started having stroke. So, Brother Shaju, could you explain what happened? I think about a couple years ago, you had this episode. Would like to hear from your mouth in terms of how it all started and what led to the hospital.
Thank you, Dr. Imran. So, 2 years, 4 months back, April 19, Sunday night, 11 o'clock in the night, I was just taking shower. Again, I want to repeat again because I guess my microphone was a little far away. So 2020, April 19th, Sunday night at 11 o'clock, I was taking shower, 11 o'clock in the night. And in the middle of shower, suddenly there was a big spike right side of my neck and up to my head. It's a different kind of pain. I mean, people will notice it's a completely different kind of pain. And if someone asks me, okay, what happened in the daytime? Were you feeling bad? Something was wrong? No, nothing. I was absolutely fine. And if you recall your memory correctly, COVID just started. COVID started around March 2020, and my stroke happened 2020 April. So the situation was different. So anyway, so I suddenly feel like a big pain and big spike in right back of my neck and up to my head, right? So I came out and I told my wife, can you check my blood pressure? Then my blood pressure came very, very high. The lower one came 125, the upper one came, I just don't know the medical term's name, and upper one came 170. So, I mean, the situation was different. Everywhere is COVID. People are dying like animal, like a bird. So I was not feeling good right away to go to the emergency or hospital. If it is now or in different time or normal time, probably I would do that right away. So I was just waiting. I thought maybe I should go bed with some extra blood pressure medicine. And just for your information, I'm taking blood pressure medicine since from 2010, okay? But it was very, very low dose. So next day, I went to one of the clinic, I'm just not mentioning the name, and they told me that I have migraine. But in my family, none of them has a migraine history, none of them. Neither from my mom's side nor from my father's side. So I got a little surprised when they told me that I got migraine, and they were telling me, oh, someone needs to start. Okay, fine. But then still, like 9 o'clock, 10 o'clock in the night, 11 o'clock in the night, still I have the same situation. So it scared me a little bit, actually not a little bit, a lot. So I decided to go to the hospital, my nearest hospital, St. David's Hospital over the 620, and I also live right next to it. So it was emergency, and after 1 hour, a doctor came to me and he said, "Hey buddy, you got a stroke." And medical term, it called subarachnoid hemorrhage. So there is a different type of hemorrhage. My one was subarachnoid hemorrhage. If I say a little bit in simple way, it's the internal bleeding in your brain. So, so I got really surprised because my understanding was when people got stroke, their body shape change, like say they cannot talk, or face position change, or like say the sense is not good, but I was kind of okay, except the big pain and my blood pressure. So this is how I became know that I got the stroke. So.
Thank you very much. So as you have heard from Brother Shaju that his symptoms, presentation was severe headache. And that could be a warning symptom for something bad. Now, a lot of us get headaches, right? So, you know, headaches are common. People do get migraine. But what was very unusual about his case was that it lasted for a long period of time. And it didn't go away. He took migraine medication. So if anyone has any bad headache and you have taken headache medication, it's not going away and you feel sleepy, and it's lasting for hours, bad sign. That means you probably need to be in the emergency room and get some testing done, at least a CAT scan or MRI. So we'll come back to Shaju's stories again in terms of what other things the doctors have done and found. But let's go back to Dr. Ahmed again in terms of, you know, how stroke presence in the hospital. I mean, you take care of hospitalized sick patients. So if you could share, first of all, how you have seen stroke patient presenting, maybe some common signs, symptoms, and then maybe expand on the treatment also. Thank you.
Thank you, Dr. Rauf. So yes, so to tell about symptoms of stroke, at first we need to know a little bit about the types of stroke. There are two broad categories of stroke. So one we call is ischemic stroke, which means is the vessels which supplies blood is blocked and blood is not passing to that specific area of the brain, and that's why the brain, we are getting symptoms. The other type is bleeding that Mr. Shaju has experienced, that whenever, for some reason, if there is bleeding inside our brain, that puts pressure on our brain and causes symptoms. So there is hemorrhagic stroke and there is ischemic stroke. So the symptoms that usually we see is these two broad categories of stroke, that when people will come in and say that they suddenly started noticing that a side of their body is feeling weak, or they're not getting sensation, or the sensation is altered. Then the other symptoms that we always see is problem with speech. They will start having what we call is stuttering of speech, or suddenly they will not be able to speak in a regular manner. Sometimes they will come with word salad, which means is they are thinking about something, they want to say something, but when it comes out as kind of all puzzled, mixed up words. We also see issues with swallowing. In this place, I just wanted to quickly share this specific pamphlet, which is very useful, very common symptoms that we see. If you see, the first one says face, which is facial droop. Very common symptoms. A lot of time we'll see people will have one side of the face drooping or having weakness in one side of the face. And then the next one says arm. So arm or leg, one side of the body weakness. Sometimes when you put your arms in front like this, one of the arm will drift downwards, or people will come and say that, hey, I'm not getting any strength in this arm or leg. I cannot get it up. I cannot move it. So that's one very big symptom of stroke, especially when it's one side of the body. The other one is, as I said, speech, that some speech difficulty which suddenly started is always a big sign. And the last one, it says time, which will come back later, which we say time because time is essence. Time is very important. Whenever this kind of symptom arises, we need to go to the emergency room. We need to notify a medical doctor who can take it from there. So the other symptoms are, of course, the hemorrhagic symptoms like Brother Shaju experienced, like severe headache. We call it thunderclap headache. Regular headache, we always get it. That's normal. But when you very suddenly get a headache which is like thunder, suddenly hits you and kind of completely, you never got a headache like this. This is so bad. Your blood pressure is high. This is not something you have ever experienced. You should be concerned. So treatment-wise, we should go about the treatment as well. Okay. So in the hospital, when we get this kind of patients, it's an emergency because, as I said, time is essence. If we can identify stroke patients within a time period, there are very good treatment options where if we if we imply those treatments, then people, can live without any disability. All the disability can be reversed. So the time period we look at is, around from when the symptoms started to 4.5 hours. This specific time period is very, very important. The reason I say that is if you can come to the hospital within this period of time, we have this treatment option which is called thrombolysis, intravenous thrombolysis, which is, in a layman term, we can say clot buster. So we can give medication which can bust the clot that blocked that artery and causing blockage of blood supply. There are, very recently, we have more sophisticated procedures that has come in the picture, just very, very recently. We call it mechanical thrombectomy, so which basically means is the interventional radiologist, there are specific, specially trained radiologists who can go inside your brain vessels with a very tiny catheter and camera, and they can suck in that clot or can break down that clot and suck it in and get all the clot out, and the blood flow goes back to normal. And whenever the blood flow goes back to normal, if it's within a specific time, a big portion of the brain cells that was not getting any blood supply and was almost dying can come back, and all the symptoms get reversed. So that's the most important thing that we look for. And there are other treatment options as well. If you're not able to come within time, do not worry, that's not the end of the world. We do have medical management. We do, aspirin, which is an antiplatelet drug. Platelet is one of the blood cells that get deposited in the blood vessels and causes blockage. So we use antiplatelet drugs. We use cholesterol medication, and also we will admit that patient to the hospital. We do some investigation to find out the risk factors for stroke. Risk factor for stroke, if it's high blood pressure and cholesterol, diabetes, we will get those treated. We do echocardiogram of the heart because we want to look at the heart, if there is any abnormality of the heart, if there is a clot in the heart, if there is an abnormal connection between the left or the right side of the heart. There are specific causes for which we need to give people blood thinner to prevent a repeat stroke from happening. And then the next very, very important thing that the hospital will do is start physical therapy, which is the most important thing in stroke, that, starting exercise and therapy that helps to reverse the disabilities. A big portion of the disabilities will improve with physical therapy. So.
Thank you very much. So that was a lot. So Dr. Ahmed covered treatment principles. What do we do when someone has a stroke? I'm just going to summarize again. So basically, the idea here is to look at the clot, finding the clot, and dissolve the clot by clot busters, Usually MRI would tell us the type of stroke, and then Dr. Esara mentioned that there are more fancier way of doing these procedures because science is really advancing. And the other thing that we always look at is with stroke, some people get complications from the heart or lungs or other problems happen because it's a big deal. Remember, brain is your controller. It's like the big controller of all your body functions. So sometimes people get other complications, breathing complications. So for those things, some people need to be in the monitor. And particularly if someone has bleeding inside the brain and the blood pushes into the brain, then people kind of lose their consciousness, feel foggy. So I'm going to go back to Brother Shaju because I remember he told me that he was sent to main St. David's in downtown for additional monitoring. So Shaju, if you could expand on the treatment, particularly the monitoring that you had, and then maybe end with your discharge from the hospital. What did the doctors do when you were there at the main St. David's? Thank you.
Thank you, Dr. Imran. So, at the beginning, as I said before, that I was 620 St. Davis, but that is not the hospital specialized for the stroke. So they sent me to the downtown St. Davis, which is specialized for the stroke. So total, I was inside the hospital for 1 month. 1 month total, my length was inside the hospital. Okay. The first 2 weeks, I was in ICU, and the last 2 weeks, I was in normal bed. So right after, when they sent me to the downtown hospital, I was like, I was kind of, I cannot really explain. It's like, I was in this world, I was not, like a foggy, like dizziness, something. It's a completely different feeling. But my sense was, I would say that yes, I had the sense. So so they did the MRI or CAT scan, whatever it is. I don't know all the medical term, and they use a very, very small camera, and they went all the way up to my brain. They tried to see the bleeding condition, where was the bleeding actually happened, which side of my brain, because even though I'm pointing, it is in the right side from my position. So the neurologists, so many doctors were there, and after that, I was a little bit of lucky because many people, they ended up with the surgery, but not me. So I like to say that I'm, yes, alhamdulillah, a little bit of lucky. So then they sent me to the, the ICU bed, and the first 72 hours was the dangerous period for me because that 72 hours, there was a possibility that for the second stroke, or something else, or like even worse, or something else. Alhamdulillah, it was, everyone was praying for me, and nothing happens first 72 hours. And so, that I was kind of like, I don't know, it is a completely differences. I wish I can explain you, but I'm like in this world, I'm not in this world, I don't know where I was, but my one thing I noticed about me, because my understanding was if someone had a stroke, they actually, their face position, and they change, they mumbling to talk, or like paralyzed, this type of symptoms. So one thing I had a paralyzed, for temporary paralyzed, I would like to say. Especially my left position, my left leg and my left hand, especially I was not feeling any kind of like sense, So, but memory-wise, I was kind of okay, because when I was in ICU, I was trying to remember my computer laptop password. And I was able to do that, and different kind of my credit card or bank information, log username, password, because I was testing myself, am I okay or not? And then I said, okay, my symptoms are not that bad. So this is how I passed like 2 weeks in ICU. And after the 2 weeks in ICU, when my situation got improved little bit, they decided to transfer me to the normal bed. But before they transfer me to the normal bed, you know that if you saw me that time, you'd probably think that I'm like a robot man. It's like a wear here, wear there, here, everywhere. It's like it reminded me of the movie, the TV series $6 Million Man. I was just looking like the bionic man, and that the COVID just started. The whole situation, the whole was different. My wife, my kids, nobody could visited me, and because they put the restrictions that no visitor allowed. So it was completely different situation mentally for me, physically, of course, because I was in the bed, and mentally it was even bad. So in the last 2 weeks in the normal bed, I was kind of okay, but I was kind of paralyzed. Not kind of, I was temporarily completely paralyzed. I could not walk without someone help, and I was kind of like a baby. Like I cannot walk, I cannot eat by myself very well. And nurse need to come to feed me or even drink me water or drinking water, like for anything. I was completely like out of everything. So
Shaju, I'm sorry to interrupt, but so by the time you got discharged, you had some weakness, if I remember, on your left side, right?
Oh, yes. I had some weakness in my left side, and I still have in my left side in the tip. People may think that I looks fine or I'm okay because I was very active volunteer last Ramadan in the mosque. People may think that, oh, he looks fine. He looks normal, but my left hand is still, I don't have that 100% normal situation.
So thank you. Thank you for expanding on your experience. And, if we have time, we'll come back to your story again in terms of how you have managed with therapy and rehab, and after rehab, how your life has evolved and how you have adjusted the weakness that you had after the stroke. And you're sharing your story is very powerful. But I wonder if people are getting scared. Are you all scared hearing all this stuff? We're talking about, some technical, clinical stuff. Dr. Ahmed shared a lot about what happened to people, how do we treat. But I'm going to maybe spend some time on prevention. So, these things could be scary. Not everyone gets stroke. Clearly, there are risk factors. So I'm gonna talk a little bit about prevention. How do you prevent it? So remember the big four I mentioned: high blood pressure, diabetes, high cholesterol, and smoking. By the way, these are also the same risk factors for heart disease. So if you pay attention to these risk factors, then you are doing the right things about reducing not only stroke, but your risk of heart disease. I particularly urge you guys, those who have high blood pressure, know your numbers. Brother Shaju can attest. He checks his blood pressure, he brings his log to the doctor, he helps the doctor's team to manage his blood pressure. If you have diabetes, control your diabetes. You can live with diabetes. Most of us, once a diabetic, it has to be, reasonable and understanding that this is something they need to live with. If you're a smoker, to my smoker friends, there are many reasons you should not smoke anyway, but there are at least 2 doctors, and you probably heard this every time you go to a doctor's office: do not smoke. Do not smoke. And smoking is a very bad risk factor for heart disease and stroke. And of course, diet, we all love food, our food, and there is actually data that, South Asians have higher risk, particularly South Asians living in the US, because of the diet. Because we eat a lot of fried, greasy food, all the biryani stuff, they are really yummy. But just think about your diet, go more vegetable, fruits, have a balanced diet, cardiac diet. So these are my 4 points. It's not magic. And the last but not the least, exercise. As you know, this is a cliche. Everyone tell you that exercise is good for your heart, and whatever you do is good for your heart, eventually would be the right thing for you to reduce your risk of stroke. So I'm gonna maybe spend a little bit of time talking about, going back to Dr. Ahmed, because, sometimes people get some of the late complications of stroke, right? I mean, you have seen people with arm weakness, leg weakness, they spend time in rehab. So if you could, maybe touch on some of the late complications of stroke, and then we'll end up with Brother Shaju in terms of hearing his stories about how he managed. So if you could expand on that, and then if needed, I can chime in.
Thank you, Dr. Rauf. Just wanted to say that, talking about all the prevention things, just wanted to re-emphasize, so important, there are risk factors that we cannot control. Family history, genetics, you can't control, but these couple of things are under your control. So these are called the modifiable risk factors. So let's try to modify our lifestyle modification is very important. So yeah, I will go to the late complication of stroke, as I said, that already know the symptoms, weakness, problem with swallowing, problem with speech. Those are very, very common. As I said, with rehab, there are specific rehab for weakness. There are specific rehab for swallowing. Some people will lose the ability of swallowing because of the muscle weakness, but with exercise, those slowly comes back. Temporarily, people might have to have a feeding tube to give nutrition, but a lot of time, those will improve a lot. Speech issue, again, with speech therapy, we will see a lot of improvement. There are other late complications that we see. There are some more immediate complications. People will sometimes get pneumonia, people will get infection just from staying in the hospital, being not able to swallow well. They sometimes will put the food on the wrong pipe instead of the the food pipe, they will put it in the breathing pipe and go to the lungs. We do see depression. Probably Dr. Rauf can talk a little bit more about it. We will, Dr. Rauf, you want to kind of?
Yeah, so depression is a big one. So after stroke, about a third of the patients in 1 year may develop depression. It's very common. And people that have multiple strokes eventually can get memory problems. What is dementia in medical terms? So stroke is a really bad deal because, if you have a bad one that leaves you paralyzed, sometimes people get serious complications like depression and memory problems. So we need to think about that. So if you are a caregiver and if you know of a family member having stroke, just work with them, watch their behaviors. If they are down or depressed, share that information with the doctors. Ask them, do you feel different? Do you feel sad or depressed? It's not uncommon that people with stroke, particularly those that have weakness, that are bedridden, they are miserable. Their quality of life suffers quite a bit. So depression is very common. Sometimes patients don't tell, when the patient comes to doctors, they don't like to say, hey doc, I'm depressed also. But it's your job as a family caregiver to look for depression. You spend most of the time with the family. So it's crucially important to think about some late complications and how someone is coping after discharge from the hospital. And we're gonna stay on that theme, and maybe our last question is for Brother Shaju. So Shaju, share how you have adjusted your life. I know you told me stories about your driving experience, managing the little bit of weakness and numbness that you have on your left arm. Could you share your experience on that, please?
Yeah, thank you, Dr. Imran. So about the symptoms of depression, I like to add one more, that after the stroke, I cannot tolerate the big noise anymore. I feel really bad if there is a big noise around me. I like to give one real example. A few months back, I went to a theater to watch a movie, Top Gun, and after 45 minutes or 30 minutes, I had to come out for 5 minutes out because the theater sound was bothering me, and which was not the case before my stroke. So this is one of the real example. so if I go back to the main question, that yes, after the stroke, you know, that everything, I got everything, the numbness, like temporary paralyzed. About the memory, I would like to say, no, I was okay. About memory-wise, I was okay, actually. Alhamdulillah, I was one of the very lucky guy. The memory-wise, I was okay. I'm still okay. But other things that I could not drive the first 1 or 2 months. My wife used to take me everywhere, especially the rehab. So this is one of the very important part I like to share a little bit with you all. I had to go rehab for 3 months, okay? So I was inpatient rehab for 7 days and then outpatient rehab for rest 2.5 months. And it was the St. Davis Hospital over 620. That helps me a lot. That helps me a lot. They taught me actually how to type in the computer, how to change the dress, or how to do the regular work like laundry, or like, they will teach you everything. They will teach you everything. And a lot of different kind of physical exercise, like they will give you the puzzle games, and they will give you some kind of quiz. Like they have many different activities there, and it helps me a lot. Slowly by slowly, I was recovering, and I was feeling okay, because first 2 months or 1.5 months, my weakness was always there. My weakness was there. And one of the important part, Dr. Imran or Dr. Sarah, they discussed about the depression. So I went to psychiatrist as well, because they were trying to figure out that how depressed I am. But alhamdulillah, that I'm lucky I'm not one of them. Even though I have known OCD, obsessive compulsive disorder, but still though depression-wise, I was fine. So so going back to the rehab, that I was recovering little by little, slowly, with different kind of activities from the rehab, inpatient and outpatient, from the 620 St. Davis. And that helps me a lot, how to type, how to change my clothes, or how to do the laundry, or how to work with the quiz or puzzle, with all this, everything. But memory-wise, alhamdulillah, I was fine.
So, Brother Shaju, looks like you have learned how to regain some of the functions that were seemingly normal for us, right? I mean, manipulation of use of the hand, getting back to those activities, and clearly rehab made a huge difference. But it's a big commitment. We can talk a lot about impact of stroke on disability and work. Some people have to take time off and whatnot. Luckily, Brother Shaju got lucky. So with that, we'll conclude our formal discussion here, and then we'll open up for questions. Thank you.
You can ask the question, and then the panelists can repeat the question before answering, please.
So I have a couple questions. First question, if we witness someone having a stroke, you mentioned they give blood thinner at the hospital. If you have access to blood thinner, should we give them blood thinner and then take them to the hospital, or should we not at all try considering doing that? Sorry? Okay. So if we witness someone that's having a stroke, you'd mentioned earlier that you guys give blood thinner in some cases. If we have access to blood thinner at home, should we give it to them or not give it to them before we take them to the hospital?
Good question. The question is, if we know if someone is having stroke, can we give blood thinners at home? Dr. Ahmed.
Very good question. I think it's not a good idea, because the first thing we need to determine is what kind of stroke is this. Is this a ischemic stroke, or it's a hemorrhagic stroke? So the management is entirely different. We do use the blood thinner. We use aspirin, antiplatelet drugs for ischemic stroke, where there is blockage of blood flow to the brain. But if you give it to a person who is having bleeding in their brain, that could be devastating, because that will cause that can cause worsening of the bleeding. So the best thing to do is to call 911. If the emergency is closed, just take them to the emergency room and leave it to the professionals.
Second question, real quick.
Yes, go ahead.
So I have a genetic predisposition to 3 of the conditions that you said out of the 4. I exercise and I eat well. What else can I do? What other preventative care things can I do?
Sorry, go ahead.
It's okay. Should I repeat the question? Okay. I said I have a genetic predisposition to 3 out of the 4 that you mentioned that could potentially increase the chances of stroke. I exercise and I eat fairly well. What else can I do to, what other preventive care things can I do?
Yeah, so the question is, if someone has all those risk factors that we mentioned, either personally, all those factors, if I understand your question correctly, right? I mean, if you have high cholesterol, blood pressure, right? Or, family history of diabetes and all those things, what else can someone do to reduce the stroke? Essentially, the big thing I think you can do is having awareness, going to your doctor. And to be honest with you, you can ask the doctor, like, what can you do to reduce your chances of what we call cardiovascular disease? So stroke falls under cardiovascular disease. So vascular means something to do with heart arteries or veins. So if you do all the right things, sounds like you are doing all the right things, which is exercise, knowing your numbers, where you are with your blood pressure and diabetes numbers. If you're not a diabetic, then that's great. Even if you have family history of diabetes, like my mom and dad, both are diabetic, I check my blood sugar every year, make sure that I am not in that range and keeping my weight down. And clearly, I think about my diet. And it's not, of course, we're doctors, we know this stuff, but it's tough. Unlike, just like you guys, I go to different parties, and Austin has a big social and party life. But you gotta watch for your health yourself. But that's a good question. I think short answer is there's really no magic thing that you can do other than the things that I have touched, the common risk factors. There are uncommon reasons, like Dr. Ahmed knows it. So sleep apnea, we didn't talk much about it. If you have sleep apnea, that in and itself is a risk factor for stroke. But again, your doctors would know if, hopefully, they'll diagnose if you have sleep apnea and they'll give you treatment for that. Thank you. I think that gentleman. Yes, sir.
Assalamu alaikum. I have 2 questions. First question for the doctors, and the second question is for Shaju Bhai. First question is, we all see in our community a lot of people with the diabetes and high blood pressure and all those, but everybody doesn't get stroke. So why is that? And let me ask the second question so Shaju Bhai can get prepared. Shaju Bhai, is the shower that you took at 11 o'clock at night, is that a normally you take shower at that time, or what happened that day? Did you play some games or anything? Why did you take that shower at that late?
Okay, good. So my question was about why some people getting stroke having all these risk factors. Like, I think, we see people with known diabetics, high blood pressure, smoker. Why some people get stroke and some don't. Essentially, there is this also, as you know, that there is a cumulative effect. So when people have all these 2 or 3 things together, the risk goes up. And to be honest with you, even if you take a really bad patient with all these factors, and we know this, not everyone actually is getting stroke. Just like a good example would be if I tell you that, there is a community of 100 smokers, and if we follow them for 10 years, how many of them would get cancer? The answer is not 100%. So the same thing also happens to diseases like stroke. Despite having all these factors, some people may not get stroke because either they have some protective mechanisms, because the disease conditions that they have are mild. Maybe they have diabetes, but we don't know. Maybe diabetes is well controlled, blood pressure is well controlled. So it also depends on their control level. But it is true that if you're a smoker, if you're diabetic, you're adding these risks. So there is this concept of cumulative risk. When you have all these things add up and make you much risky. And if you take history, then you'll find that these people, they don't exercise, maybe they were a smoker before and whatnot. So these things combine.
So, Brother Quraishi, thank you so much. Very interesting question about my shower time. So, usually I don't take shower in daytime except before Juma. I usually take shower always like at 10, 11 o'clock. So, that's all, nothing special. And one thing, I mean, I don't know, I never Google search or I never heard from any doctor, but they're here, they can tell me. People say that when you take shower, wash your body first before the head, you know. But maybe there is some scientific reason. I don't know anything about it. And also, especially like if you have any risk factor, like say high blood pressure, diabetic, or any kind of existing precondition, you know, maybe you have a lungs issue or something like that, some of the stuff you should avoid, like say, if you think that, if you believe that if you involve this matter, or if you involve this issue, family issue, if you call him, or if you contact with him, it can create some anxiety within you. You should always avoid them. And also try not to lift something very heavy, especially like even if you're 40 plus or 50 or 60, always try to get help from someone. Even if you know that this is nothing for you, you can do it, you know. I mean, you can have it, you may have the US passport like me, but it's made in Asia, you know. So.
Thank you.
We have the sister side.
Any more questions?
Assalamu alaikum. Thank you. It has been very informative, all your presentation. My question is regarding a repeat, like if you get a stroke again, will it be the same type? Will it be the ischemic type, or will it be the hemorrhagic type? What are the chances of that you see in practice? And so just to kind of see what to expect ahead if you are already a stroke victim. Thank you.
I did not. Would you be able to repeat the question one more time?
So I'm wondering if, say that a patient is going to get a stroke again, are they going to get the same kind, the ischemic or the hemorrhagic kind? Or is there a different presentation? Is it more severe? What have you seen in practice?
Okay, all right. Thank you so much. Usually, I mean, if somebody gets an ischemic stroke, like the blockage, in the immediate period after the stroke, they have high probability of getting the similar kind of stroke, another ischemic stroke. For the bleeding, same issue. If somebody has bleeding in the immediate period of time after that stroke, they have the risk of re-bleeding because of the pressure. The pressure gets really uncontrolled after a stroke, so they can get re-bleeding. The bleeding can expand. But after that period is over, I mean, it's hard to really predict which kind of stroke they're going to get. Of course, the main risk factor for getting the hemorrhagic stroke is uncontrolled blood pressure, or if there is sometimes there will be some abnormalities in the brain blood vessels, and those can sometimes rupture and can start bleeding. So if you have known risk factors, like you have uncontrolled high blood pressure, or if you have known abnormalities of the blood vessels like an aneurysm, then those people are more at risk of getting another hemorrhagic stroke. People who has risk factors for getting blockage in their arteries, like high blood pressure, diabetes, cholesterol, they are more at risk of getting an ischemic stroke. We do see ischemic stroke much more than hemorrhagic stroke. 80% of the stroke we see are the ischemic stroke. I would say that ischemic stroke is probably the lesser of the evil. A lot of time, hemorrhagic stroke, especially if those are big, can be really debilitating. So,
Yeah, thank you. So Dr. Ahmed expanded on quite a bit. So I'm going to say that yes, the chances are, most of the people are getting ischemic stroke. And if someone gets ischemic stroke, maybe not in the aftermath, weeks or months, things may not happen. It may happen, again, depending on the risk factors. But maybe we see down the road, 1-2 years out, sometimes people do get a second stroke, even when risk factors are controlled. Having a stroke, as I mentioned earlier, is in and itself is a risk factor for getting a second stroke. It just happens. So maybe we'll have time for one more question, then we'll wrap up. Thank you.
So my question is, any relationship between
So the question is there any relationship between stroke and cardiac arrest? Okay, so maybe I'll ask the tough one. It's, Dr. Ahmed, then I'll chime in.
well, I'd probably say it's not directly related, but indirectly, yes, absolutely, it can happen. So if it's a massive stroke, which can cause other complication, like people get, I said, like when they get massive stroke, they can get their airway, their airway muscle, their swallowing muscle does not work properly. At that period of time, people can get their breathing, airway might, the reason we get cardiac arrest is when we're not getting, our airway, our breathing, those are stopping, and at that point our heart stops. That is called cardiac arrest, when our heart stops. So directly, stroke possibly will not immediately cause cardiac arrest, but as a complication of stroke, we do see some people can go to like deep coma, their heart can stop because of the complications.
Yeah, Dr. Ahmed is spot on. There is no direct relationship between having a stroke and cardiac arrest. We don't see that. But if someone has a massive stroke, the blood pressure drops down. And if someone's blood pressure drops down, heart doesn't like it. Or if lung is compromised, if lung function gets really low or having problem, sometimes that in itself can cause strain to the heart, and heart attack happens or cardiac arrest happens. But that's not something happens very commonly, or stroke is not a direct cause of cardiac arrest.
Assalamu alaikum, everyone, and thank you for having this discussion again. My question is for Mr. Shaju Bhai. So I understand you had the stroke, but before that, was there anything syndrome that you could feel that it is coming, or anywhere in your life-wise, how you behave with your, say, everyday life with exercise or food? Were you feeling any uncomfortable that it's almost getting to that level?
Thank you so much for your question. A very good question. So it is, that's why when I was in the ICU emergency room at day one, I got very surprised. Why I got surprised? Because there was no symptom. I had stroke at 11 o'clock in the night, Sunday, 19th April 2020. But if you want me to go back, previous 3 days or 4 days or even the same day, there is no symptom. And you know that I was actually your home, having good time with you, with Mukit, and having some sweet, laughing, good chat, conversation, came home and went for shower, and suddenly it happened without any issue. And the same day, I was driving to Lago Vista before I went to Mukit house because, this COVID, I cannot go anyone's house. I don't know what to do besides to watch movies. So trying to pass my time, go to Lago Vista. Then I ended up Mukit house, some good time in his backyard, beautiful backyard, and then came home, went for shower, and all happened. Yes.
And we'll be available here after Isha, inshallah, to answer your questions. I know there's
So,
about-
one last question. So, without knowing which type of stroke you might run into or have, one can be a bleeding in the brain, or another one can be a blockage, some portions of the brain. People as a preventative take baby aspirin daily basis. So is it a good idea, not a good idea? Because if it's a bleeding can happen, this can accelerate that process because the blood thinner, basically. And this person or we normally take that as a precaution, but without knowing what might happen in the future.
Yeah, so I'm just answer it very briefly, and we can expand on it after the prayer. So basically, if I understand your questions, the role of aspirin, right? The role of aspirin to prevent ischemic stroke or hemorrhagic stroke. Usually the standard of care is not to give aspirin, which is a blood thinner, in the setting of a bleeding stroke, hemorrhagic stroke. Sometimes clinically it's hard to know. So usually when patient shows up in the emergency room and gets CAT scan or MRI, we know that it's ischemic stroke. We usually give aspirin, full aspirin. But usually it's not a good idea to just if you suspect someone having stroke, to give aspirin for the same risk, because you just don't know if this is bleeding versus a non-bleeding, right? So it's safe not to give aspirin at home. And if you look at the standards of care, they don't recommend taking aspirin. Unlike heart attack, heart attack patient can take aspirin. So that's a short answer. Thank you.
No, my question was on a daily basis, baby aspirin.
So well, if you are already taking baby aspirin that was recommended by your physician, you take it daily as recommended. However, if you start experiencing some kind of symptom that is concerning, I would recommend not taking aspirin at that point of time. But in a regular basis, that the aspirin you take, you keep taking that. Okay? Thank you.
Allahu Akbar, Allahu Akbar.